Welcome back. Therapeutic limit setting, marriage and family play therapy with Dr. Landreth's book, Play Therapy, The Art of the Relationship. This is on therapeutic limit setting. Basic guidelines to limit setting. It's an important aspect in play therapy. It's also problematic. We want to build the relationship. We want to build a bridge. At the same time, very difficult to do when we are looking at holding the right limits for safety. According to Mastakis in 1959, therapy cannot occur without limits. Limit setting is the single most difficult area for play therapists, but the reality is that our society and where our clients go back into is full of limit setting in the schoolroom, in the family, in the community. And if we don't teach our clients to set limits and boundaries for themselves, society will sometimes take them places they would not like to go and put them in check where there are limits. Permissiveness in the play therapy approach does not mean acceptance of all behaviors. Therapy is a learning experience, and limits provide children with an opportunity to learn self-control, to practice appropriate choices, what making choices and those consequences feel like, what responsibility feels like. The therapy belief that children will choose positive cooperative behavior is a significant and impactful variable in the therapeutic process. Children are more likely to comply with limits when they experience respect for themselves and acceptance for their own feelings and behaviors, both negative and positive. Limits in the playroom should be minimal and enforceable. We can't learn about ourselves and adequately express ourselves in the face of a multitude of limits. And unenforceable limits do great harm to the therapeutic relationship because then it impacts the developmental of trust. So we're looking at conditional limits, things that are not confusing. We're looking at total limits instead of conditional limits. Total limits are less confusing. If you say, you may pinch me, but you may not hurt me, that's conditional, and it leaves the issue wide open when it becomes hurtful. You may put a little water in the sand. The child may not know what little is. Their idea of little and your idea of little might be totally different. A total limit would be, it's not okay to pinch me. It's not okay to pinch Miss Shannon in there. Instead of, you can't kick the door hard. You can't kick the door hard. I didn't kick it hard. I think you kicked it hard. No, I didn't kick it hard. Then therapy has become an argument between you and the client. So you restate the original limit and say, you would like for me to argue with you or convince you that we don't shoot the mirror, but the mirror is not for shooting. In a calm, patient, matter-of-fact, firm way. Not rushed, not stated quickly, not based on anxiety or lack of trust in the child by the therapist, but really trust and belief that the child will respond responsibly and the therapist will respond with calmness and say, this is the way we do things in the playroom. If we're able to stay in the playroom, these are the things that we have to do in order to be able to come in here. The focus and emphasis is always on the child to clearly convey where the responsibility lies. In the playroom, we don't throw paint on the floor. So in the playroom, and it's not, I guess the issue Dr. Landreth is raising here is if you say in the playroom we don't take our clothes off, we don't throw paint on the floor, leaves it open for the child to wonder if the therapist might sometimes do that. So that's why he states it backwards. Paint is not for throwing on the floor. Clothes are meant to be kept on our bodies. And he states it very positively and more from a situation based on the object than on the person. Limits should be part of the general introduction at the first session on some small level, but typically limits are not needed until they're needed. Self-control cannot be learned until opportunity to exercise self-control occurs. Now, that Dr. Landreth is very much a purist. In my own play therapy room, I will say at the beginning, We have to take care of the toys. Other children come in here. We can't take them home. We can't break them. And I kind of leave it with that. I will say we're going to be in here for 20 or 30 minutes, and then will be time for you to leave and go back where your mom is. But as far as things like throwing the paint on the floor, or trying to take their clothes off, or trying to hit the therapist with something, those things I wait until they actually begin to occur prior to doing it. A rationale for therapeutic limits is based on sound principles. Limits are based on clear, definable criteria supported by clearly thought out rationale with the furtherance of the therapeutic relationship in mind, not simply rules for the sake of having rules. Angry, aggressive children tend to sometimes exhibit a desire to break the limit. That has a great therapeutic significance. The desire to do it is more therapeutically significant than the act itself. So to say to them, you can think anything you want to think, you can feel any way that you want to feel, accepting feelings, desires, and wishes, always acceptable. But not all behavior is acceptable, not all things that you would say. Destructive behavior cannot be accepted. Because the child has to be able to express themselves symbolically without fear of reprimand or rejection, but not actually act out aggressive or inappropriate behaviors that impact physical and emotional security for the child, for the playroom, for other clients, for the therapist. It's conducive to a feeling of permissiveness, which is the key word, more so than actual permissiveness without limits. The growth potential in children cannot be maximized in settings if they feel insecure. So when no boundaries or limitations on their behavior exist, children feel out of control, insecure. They experience anxiety. Limits are there to provide structure to the environment, the relationship, to foster security, to foster controlling impulsiveness, and experiencing limits in a way that sets them with an opportunity to gain control of their behavior, to assure the emotional security of the children, predictability for the relationship and the setting. Limits protect the physical well-being of the therapist and facilitate acceptance of the child. The therapist's physical safety, the room's physical safety, emotional, physical comfort are important dimensions in the process. You can't conduct therapy if you're dodging building blocks being thrown at your head from across the room. Any form of direct, aggressive, physical acting out attack of the therapist should be absolutely prohibited, not tolerated, it will interfere with the therapist's empathic acceptance, respect for the child, and objectivity. Play therapists are not super people. They have the right to be protected from any kind of attack. And it's okay to limit the time in the playroom until those behavioral limits are imposed by the child on the child. Limits facilitate the development of decision-making, self-control, and self-responsibility. They have to have an awareness of their behavior, or an awareness that it's wrong, a feeling of responsibility, an opportunity to exercise self-control. The wall is not for painting on. It's a lot different than saying, don't paint on the wall, which can be thrown down as sort of a gauntlet. The decisions of the child, responsibility accompanies the decision making, as well as consequences, positive or negative for those behaviors. Limits anchor the session to reality and emphasize the here and now. The outside world imposes its own limits. There's some things we can do in the playroom that we can't do outside in the world, but there are always things that require us to limits. Limits exist in every relationship that has any significance. And the playroom relationship and the play therapy relationship has to have significance, so limits are in place. Limits promote consistency in the playroom environment. I know what to expect in here. I know what the structure will be here. I know what Miss Shannon is going to be like in there. I know what my session is going to be like in there. It's non-threatening, it's not rigid, but it's consistent. Limits preserve the professional, ethical, and socially acceptable relationship. It stops things from going into a direction that play therapists would not want to do, like children who have been sexually abused taking off their clothes, attempting to be highly sexualized with the therapist. They should not be allowed to be engaged in those behaviors with the therapist, or with each other, or with themselves. Limits protect the play therapy materials and the room. Bobo is for hitting. He's not for stabbing with scissors. He's made to be hit. He's not made to be stabbed with scissors or cut up. Procedures in therapeutic limit setting. The play therapist is the facilitator of expression rather than a prohibitor of action. I facilitate what's right, not an authority figure who tells you what is wrong. And I do it very clearly, not with argumentative. I don't say, don't you do that, or I don't think you should do that. I say, this is not something we can do in here. We can't paint the walls in here. The wall is not for painting on. The rule is that we don't paint the wall in here. So, several steps are used in the therapeutic limit setting process. Some of this is on the test that you will take. The ACT acronym. Step 1, A, acknowledge the child's feelings, wishes, and wants. Feelings should be reflected as soon as they're recognized. You seem to be very angry at me. Step 2, C, communicate the limit. While you feel angry with me, it is still not okay to hit the window or to throw things in the room. Step 3, target acceptable alternatives, the T. The wall is not for painting on. However, you can choose to paint on the easel or the block of wood or on the paper. I'm not for hitting, but you can choose to hit Bobo. ACT, acknowledge the child's feelings, wishes, and wants, communicate the limit, target acceptable alternatives. And on page 262, they give you another little brief session. When limits are broken, when behaviors are being tested, and battles of will are occurring, patience is the rule of the day. You can leave the play therapy room for that day. You can limit going into the play therapy room for a period of time the following visit, but you have to state the final choice. And the final choice is the consequence that says, this is your final choice to make a consequence choice for your behavior. Since we have not been able to not paint on the wall or throw things in the room, we will have to leave the playroom. You have chosen for us to leave the playroom for today. And it's not to present it for a child as a choice to a child who's manipulative and already wanting to leave. So you have to be very, very careful in assessing the behavior and the thought process underneath the behavior. Tentativeness in limit setting. Matter of fact, sureness, conviction, calmness, patience. Starting to leave the room 30 minutes before the session. Let's stay for the rest of our time instead of going out. Probably isn't going to work. A suggestion would be, our time is not up for today. We have 30 more minutes and then you can leave. A very definitive, clear limit setting. Situational limits, taking toys and materials from the playroom. Can I just please have this one little toy? And while it's very easy sometimes to get into that, it sets a bad precedent because the toys have to stay in the playroom so that we have a complete set of things for other children who come in. Leaving the playroom. We can't run away from the responsibility of seeing our session through. The commitment to the relationship means staying, working things out. Parents should be given the responsibility to take the child to the bathroom prior to. If you have a very small child, it might be necessary for them to go. At that point, you would want to walk them and maintain their safety. Time limits. If you have a 45-minute session, 15 minutes between to get ready for the next child, you may want to start saying, we have 10 more minutes that will be in here. We have 5 more minutes. We have about 1 or 2 more minutes left to go. Trying to limit noise as much as is necessary for the other people in the practice, but in general, the playroom has to be a place where noise can be made. Children are not allowed to play with personal items of the therapist, to overflow the water in the sandbox, to urinate in the playroom or in the sandbox. And they give you on page 272 another little brief set of scenarios, 2 little scenarios with Joanna and Carmen. So that takes us to the end of limit setting, and we will pick back up.